Hello, welcome to another online lecture, a quick review to set you up and prepare you for the information presented in the text. This one's for Chapter 21 on Cerebral Palsy. Today we're going to be talking about one of the disorders that do come up, and it's a medical-based disorder. Some of the key points we're going to talk about is what is it, what causes cerebral palsy, how is cerebral palsy diagnosed, the phenotypes or subtypes of cerebral palsy, and then the treatment or prognosis of cerebral palsy. So what causes cerebral palsy? Well, the brain development is disrupted while forming in the womb. So this brain's developing, we've talked about that in earlier chapters. This brain's developing and something happens, and this brain is disrupted with the formation while in utero. So this specifically affects the brain's neural networks and pathways. Think of it like highways that get closed down that restrict traffic. These highways, once closed down or restricting traffic, things aren't getting through as much as they should, and that's the only way I can kind of give an analogy to it. But this can happen at various periods of development in the womb, even during birth. So during the first 12 weeks is the first time that we found that there is some alignment with brain issues, development of the brain, and cerebral palsy, and that's when the brain mass is forming. It's extremely susceptible at that time to malformations, and this can lead to cerebral palsy. So the brain itself is actually forming, the lobes are forming, the folds you see in the brain that make it look like a walnut, that's forming in it. And if something happens in those first 12 weeks, that can create a situation that can lead down the line to cerebral palsy. Also, between 24 and 36 weeks, those protective sheets called myelin, those are what are around the nerve cells, those begin to be built. There's certain other cells that are in charge of doing that. If those cells are affected and this myelin's not being built properly around it, the result is often spastic forms of cerebral palsy. Also, at birth, if there's a restriction of the blood or oxygen during birth itself, there is a risk of cerebral palsy occurring because of that. It increases greatly. A lot of people think that, cerebral palsy is caused by that. They think of this last example of at birth and the restriction of oxygen or blood. But as the book notes, the account, it only accounts for about 2 to 10% of the cases. So it's actually a minority of cases compared to what most people may think. So understanding how and when cerebral palsy occurred is a key to developing these treatment plans for the symptoms. Doctors, physicians, diagnostic tools, they need to know what part of the developmental process is affected. That helps them decide on the most efficient means of treatment, help that individual developmentally through the beginning of their life and then later on as an adult. So how is cerebral palsy diagnosed? Well, obviously it's done via a doctor, and usually initially it's done through observations. There may be some suspicions a doctor has due to the delay in expected motor functions. Like I said, by 12 months, there's supposed to be certain things that occur. So a doctor will realize this and do some observations, and It can be confirmed by neurological examinations, which can be visual, hands-on. So they might visually confirm dystonia or twisting, the things that they could visually see that the child's doing that isn't something that should be occurring at that developmental milestone in their life. Or they might confirm it through touch for recognition of like the resistance or spasms or hypotonia. They can, physically inspect with their hands an individual to find out, is there more resistance pulling back in this direction than there should be? Are there spasms? Or is there a reduced muscle mass when you kind of pinch and feel around? They know how much is supposed to be there, for, again, these developmental milestones. If it's not there, then at that point, they know that maybe they're going to need to look at some further confirmation, which can be done via medical imagery, like the MRI. So they might do an MRI and they might be able to find something that way. I do see the typo here, but I don't want to re-record the lesson. So yes, further confirmation is spelled wrong. All right. So one area that diagnostic criteria look at is the extended use of the primitive reflexes. So this is kind of an initial key. This might be the first step. A doctor may see this. More commonly, they'll see this before anything else to say something is not right. These primitive reflexes, things like the suckling and some of the reflexes that these newborns have up to about 12 months of age, those should start to retreat. You shouldn't see some of those as much as you do, and other movements should take their place. If a doctor notices that that's not occurring, that's when they might do further screenings and further investigation into whether or not the child has cerebral palsy or not. So there are phenotypes or subtypes of cerebral palsy. The first part is the spastic cerebral palsy. That's the most common. This is the one seen most often, and this occurs due to increases in muscle. So there's an increased muscle tone. They're not larger muscles, but they're stronger and they're more toned due to spasticity. So because of that, things kind of, the best way I could put it, they lock down. And this can present restriction, voluntary movement, eventually leading to permanent contractures, such as arms being forced in certain directions, the hands being closed into a fist. Those things can be permanent. There is physical therapy, occupational therapy, things like that that kind of lessen it a bit, but once that happens, like that is not necessarily reversible. So there's also dyskinetic cerebral palsy, which that presents itself as a twisting, distorted postures. They call this dystonia. The twisting, the turning, the strange position. So if you would see somebody sitting upright in a chair, but their upper half is turned sideways, like permanently, and that looks like where they're at comfortably, that's probably a sign. Ataxic cerebral palsy presents itself as uncontrolled jerking. It's movements with little control. So it's a lot of movements, jerking, twitching, things of the body being, moved in certain directions that don't look like we might consider natural movements, where the individual does not really have much control. And then, to complicate things, there's a mixed cerebral palsy, and that's where some of these cases have a mixture of any of these types mentioned above. This can create really complicated treatment plans due to the mixed up treatment type, or due to the mixed up diagnosis type. That can create some very complicated treatment plans, because now at this point you are looking at multiple areas to treat based on how much is a spastic issue versus a dyskinetic issue. From there, when you do see a diagnosis, it may put down that there's further divisions such as the bilateral. So they may have spastic cerebral palsy bilateral, which means both sides of the body are affected. Or it may be unilateral, where only one side of the body is affected. And besides cerebral palsy, there's often comorbid occurrences of impairments. A lot of individuals with cerebral palsy do have other disabilities: visual, hearing, speech, intellectual disabilities. Those things all are relatively very common with individuals who have cerebral palsy. So, unfortunately, it's not just, it complicates treatment plans even more. And unfortunately, the individual isn't going to have to just work through cerebral palsy in their life. They're also going to have to look at other disorders or disabilities that they're going to have to learn to function with or work through. So What about the treatment, prognosis? What can be done to treat individuals with cerebral palsy? Well, the word neuroplasticity, that is a word, and that is important because that is that focuses on the ability of the brain to change over time. And when the brain can change over time, it can also change certain things that it controls, like the nervous system. And that's often done based on environmental stimuli. Now, timing is crucial since a child's brain is more flexible than an adult's brain. So if for some reason, I don't know why this occurs, maybe in certain countries that maybe don't have great medical care, maybe even certain parts of this country that don't have it, it may take longer to diagnose an individual with cerebral palsy. The longer that takes, the less likely they're going to have comfortable treatment plans that have helped them become as functional as possible. The child's brain is extremely flexible compared to an adult's brain, so these treatment plans really need to be initiated as soon as possible. And I put this in quotations. It's an important piece to think about, and the book says it perfectly, so I'm not even going to try to paraphrase it. But the management of cerebral palsy is based upon the recognition that each child requires a unique combination of medical and rehabilitative interventions. So when I say that treatment plans are complicated, yes, they're extremely complicated. It'd probably be hard to find two individuals with cerebral palsy that have similar or same treatment plans. The management of these symptoms is divided into three main components. You're going to have the rehabilitative component, which occupational physical therapy, augmented communication devices, mobility devices that can assist with that rehabilitative aspect. Then there's medical or medications that can also be taken to help reduce the spasticity that occurs with an individual. And then, and I've seen this in some cases, there's surgical interventions, orthopedic surgery. They will actually go in and cut tendons and cut certain things that will, or even loosen it up in ways that do then allow an individual to have more flexibility. You can probably guess that that's not a surgery that occurs often unless somebody has very good insurance or a very good advocate or a lot of money aside, because a lot of times insurance companies will consider something like that optional. At least they did when I worked about 15 years ago with adults with developmental disabilities. So we'll see. Hopefully things change over time on that. But as new treatment options become available, individuals with cerebral palsy living longer and more normalized lives. As time goes on, there's better treatments, there's better management techniques, and as we continue, fortunately and hopefully we'll continue to grow, and people will even have a better chance of being as functional as possible and as independent as possible. All right, thank you. I appreciate it. And if you have any questions, comments, or concerns, please email me directly. I encourage any correspondence whatsoever email. I will usually get back to you if it's an email directly sent to me. Hopefully within 24 hours, especially if that's during the work week. So, all right, thank you again.